Effective hoof care is vital for a horse's health. Laminitis or founder is a serious concern where trauma decreases blood flow to the laminae supporting the coffin bone. Some of the causes include overeating rich feed, obesity, or improper hoof trimming. Treatment requires non-steroidal anti-inflammatory drugs as well as blood thinners to increase blood flow to the hoof, and crucially supporting the frog uh, so that the horse does not further damage that hoof. Um, Navicular syndrome, it's a very common cause of forelimb lameness, and it usually requires rest as well as non-steroidal anti-inflammatory drugs. Sometimes, if the pain is more severe, it'll need blocking or local anesthetic to the affected area. Um, and then for hoof infections like thrush and canker, they're usually packed with a medicated bandage under the hoof, supporting the frog. Thrush usually affects the central and lateral sulci, while canker tends to affect the entire body of the frog. And in its early stages is commonly confused for thrush with inexperienced veterinarians. But majority of these ailments are preventable, and some of them arise from improper or unsanitary conditions for the horse to be walking around in, as well as traumas for walking where they shouldn't. It's important for horse owners to be able to manage where their horses are going and what they're doing when they're away from the owner. In bone problems, there are a lot of different bone problems that horses can get. One being called ring bone, it can be classified into two different types. There's articular and non-articular. In articular ring bone, the bones themselves are affected, while in non-articular ring bone, the tissues surrounding the bones are affected. It can also be in two different locations. High ring bone affects the proximal and middle phalanges, while low ring bone affects the middle and coffin bone. High articular ring bone is treatable with surgical joint fusion, and low articular ring bone is untreatable. You can administer non-steroidal anti-inflammatory drugs, but it will only to be relieve the pain. DODs, or developmental orthopedic diseases, it's a range of issues that apply to young growing horses, including osteochondrosis, which is a defect where cartilage does not develop to bone properly, and they develop unevenly and lead to crooked legs. Treatment typically requires removing bone fragments or loose bodies in joints like the stifles or the fetlocks. A locked stifle is like an upward fixation of the patella. It tends to show as the horse has a locked leg and drags it behind them as they're moving. It's best treated with an easy surgery on a standing but locally anesthetized horse to cut the medial patellar ligament, and it is followed by physical therapy. Stress fractures are commonly caused by repeated use on horses that are not used to excessive training, and they tend to be preventable by gradually increasing training. Pregnant mares need to be handled with extreme caution. Owners need to manage their mares very carefully. Surprise foaling can occur because mares don't show they're pregnant all the way up until labor, and it can also be from the negligence of the owner letting or keeping sexes that are unfixed in close quarters. It can also be life-threatening to some mares that aren't developed enough to carry a foal to term. So these are just some of the things that we need to keep in mind. Pregnant mares can also slip or abort their foal at any point in their pregnancy. It's important to monitor their feed intake after they do slip, because they're no longer eating for two and don't need as much food. There are some plants to look out for pregnant mares, like tall fescue. It needs to be withheld from pregnant mares entirely because it can lead to agalactia, which is the production of no milk, and hypogalactia, which is the production of little to no milk. It can also lead to the foal slipping, or the mare not having mammary glands prepared at the time of foaling, and it is just a big issue for during labor, before labor, and after. One more thing to keep in mind is pinched intestines. It happens when the foal rotates inside the mare's body and pinches the intestines against anything hard inside the mare's body, that it'll cause extreme pain, and typically to relieve that pain, it involves inducing labor, and that foal may come out before its full term, and it can lead to underdeveloped or weak offspring from the early birth. General horse care. Owners are entirely responsible for their horse's food intake. Overeating is not on the horse. They have no self-regulatory mechanism to keep them from overeating, and they will eat themselves to death, colic, or founder. Water intake. Making sure that your horse has clean and fresh water is extremely important. Using automatic waterers or buckets to do so is heavily recommended. Making sure they're not getting into dirty water in their pastures is also recommended. Routine dental care is vital, and your horse at any point will need it. If a horse stops eating, chewing, and or spits its food out, it most likely needs its teeth floated, which is getting rid of the sharp points in the enamel in the horse's mouth and on its teeth. The canine teeth and hooks will need to be monitored and possibly removed or filed to prevent bit interference or pain in the horse's mouth, and they can also lead to chewing abnormalities. Tying up is a result of the owner overlooking their horse's readiness to compete. When a horse is resting for a long period of time, it isn't ready to get into the arena and compete at its top performance yet. And it results from tying up results from overexertion, and it can, some of the signs are a extremely anxious horse, or the urine is reddish brown from the presence of myobin in their urine because of muscle breakdown. And it is extremely important to know your horse's boundaries, as well as make sure it has safe boundaries that you can push as well as it can push, and that it can handle the work that you're throwing towards it. Vices are habits that the horse has that tend to be more annoying to owners than they are harmful to the horse. They can be as small as the horse throwing food, or kicking the stall, or biting at you while you're trying to work with it while it's in stall. They usually aren't life-threatening, but they sometimes can be harmful. Some horses will bite their legs and stuff and end up cutting themselves a little bit, and those cuts can lead to infection. Some also chew on wood inside their stall, and the wood will get into their teeth, and those foreign bodies can lead to infection. So it's very important that you get a pre-purchase exam done, and you see what you're getting into with horse ownership.